8:23 right now. You know, diabetes can often go unnoticed, and in honor of National Diabetes Awareness Month, we're going to talk prevention.
Joining us now, Lori Mulichak. She is the Senior Vice President of Medical Management at Buckeye Health Plan. Good morning.
Good morning.
So let's talk about how diabetes affects Ohioans.
So an alarming 1 million Ohioans have prediabetes, and they are not aware of it. In addition to that, there are about 1 million Ohioans that actually have the disease and about 800,000 that are pre-diabetic. So the risk and the impact of having undiagnosed diabetes is pretty big. Diabetes unmanaged can go on to have heart disease. You could end up with kidney failure. You could end up with vision problems and vision loss and amputation. So it's really, really important that we educate our community about diabetes, especially this month, which is November is Diabetes Month.
Right. And you know, that is true. I think people think that will not happen to them. I had a friend who did not manage his well, and he lost his foot.
Absolutely.
He had his foot
uncommon.
amputated, you know, 42 years old, had to have his foot cut off. All right, so it's so important to know the symptoms. Like you said, so many people don't even realize they're in pre-diabetes.
Right.
What do we need to look for?
Well, you know, the symptoms are really subtle, but they can also be things like increased thirst, much more so than normal, increased hunger, and then weight loss that goes along with this increased hunger, and then increased urination. There can also be some other symptoms such as vision changes, some vision loss even, numbness and tingling in your hands and feet, fatigue, and those kinds of symptoms should really be checked by the primary care physician.
So if you think maybe this is some sort of path you're on, is there anything you can do to delay the onset of diabetes?
Yes, so type 2 diabetes is largely influenced by your genetics as well as your lifestyle choices, such as poor diet and lack of exercise and obesity. So some of the things that you can actually do to prevent the risk of diabetes in your life is to improve your diet. So have a healthy, balanced diet, reduce your processed food intake and saturated fats, increase your fiber and lean protein, increase your activity level, get up and move around, do 10,000 steps a day. If you are a little bit overweight, especially around your middle, lose that weight. 5% of a body weight loss can really improve the likelihood of you not getting diabetes. Stop smoking. Smokers have 30 to 40% chance of getting diabetes, so we want to definitely stop smoking. Get checked. That's probably the most important thing. Get to your PCP, get your fasting blood sugar checked. Know if you are diabetic, know what your hemoglobin A1C is. And finally, if you are diagnosed with diabetes, get support. If you belong to a health plan like Buckeye Health Plan, call and find out what kind of programs there are available. For Buckeye Health Plan members, we have care managers that are educated in diabetes that can help our members, as well as we have a 6-week training program for our diabetics that that can actually learn how to manage their diabetes. So if you go to our Buckeye Facebook page, you can find out more about that.
We have to take it seriously.
Absolutely.
All right, Lori.
Stay healthy.
Thank you.
Thanks
for being here.